Okay, so this is Amy Lujan with Juneau Gastineau Rotary on June 10th, 2021. And we're pleased to have with us today Claudette Thor, who is representing the Front Street Clinic to tell us about the clinic and its work here in Juneau. So Claudette, I'll let you take it from here.
Okay, thank you. I really appreciate being invited and apologize for my technical issues. I had a beautiful PowerPoint, however, because I had to move computers, I was unable to access that. So it's all me. Anyway, my name's Claudette Thor. I am the healthcare for the homeless clinic manager. I've been here with Search at Front Street Clinic for about 4 years now. I came in a clinical position as a therapist, and approximately 2 years ago stepped into the leadership role. Anyway, so my background is working with opioid treatment programs and community mental health prior to coming to Search. So Front Street Clinic is a not-profit federally qualified health center. We receive funding from the Health Resources and Services Administration, or HRSA, which to be considered an FQHC and receive HRSA funding, we have to follow stringent requirements. But that allows us to provide services to anybody, regardless of their ability to pay on a sliding scale. We have been an FQHC here in Juneau. I believe we started receiving funding in 2002. So we've been here now almost 20 years. So some of the services we provide, well, let's go back to payer source first. So again, we have a sliding scale. We also accept Medicaid, Medicare, private insurance. We see Native Alaskan and American Indian beneficiaries. And we also provide payment for those that are uninsured or on our sliding scale for prescriptions, and pay all Medicaid co-pays for our patients. Again, we provide services for anybody, regardless of their ability to pay. Our services include medical. So we provide primary care services that include vaccines, things like shingles, tetanus, pneumonia, for adults 18 years and over. We do COVID-19 immunizations as well as testing. We can do both PCR testing, which is a send out and takes approximately 2 days to get test results back. And we have on the site rapid testing with an Abbott, which is not a PCR, so does not work for things like if somebody needs proof of a test prior to flying, going out of the country, things like that. We provide medication management for chronic illness, things like diabetes, asthma, just typical primary care, colds, flus. We have medication assisted treatment for people with addictions, things like Suboxone treatment for opioid use disorder, Vivitrol for alcohol use disorder. We do well women's exams and contraceptives, testing for sexually transmitted infections or disease, hepatitis testing and treatment. I'm trying to think what else. And medical case management. So if it's a service we can't provide here, in something such as MRIs, CT scans, other radiology, specialty care. We help link people to those services. We also do medication prior authorizations. So if somebody needs a medication that is not formulary, our case managers can work with our providers and the payer source to ensure that people have the medications they need. We also arrange travel for medical surgeries, whatever testing that's not available here in Juneau. And then finally, we do physicals for those people that are trying to get into addiction treatment. So for an example, at Rainforest, we do the physicals, so they're allowed in there. We also have behavioral health services. We provide screening and assessment. Again, that can be for services on site, so therapy services or case management and psychoeducation services, or for those people that are looking and getting into a higher level of care. For example, residential substance use treatment. We also have dental services, primarily cleaning, fillings, extractions, but they do some other more comprehensive services as available. So dental services are currently only provided twice a week. Behavioral health services are 5 days a week, and those can be both in the community or in the office, and medical services 5 days a week, Monday through Friday. One of the things we're really excited to announce is we currently just received a mobile medical unit. This is a 24-foot van that has 2 exam rooms. We have the ability to do the same services that we provide on site in the community. This can include things like wound care, testing, preventative care, vaccines. We can take the van to you, so anywhere in the community. Recently, we've done vaccine clinics at the Glory Hall from the van. We went to Mill Creek Campground and provided some vaccines and some supportive services. So we hope to be able to expand outside of medical and start providing some. Can you still hear me?
Yep.
Okay. Hope to soon provide some additional services for behavioral health, so we can screen and assess people for treatment services directly from the van. And so those people don't have to try and find a way to come to us. If anybody is interested in having mobile services on site at your business, somewhere in the community, or sees a need, feel free to reach out to me and we'll make it happen. So outside of the medical, dental, and behavioral health services, we also provide some supportive services. We do overdose prevention, which is education and Supply Project Hope Narcan kits. We also offer fentanyl test strips to help reduce the risk of overdose for those people that are using opioids. We have condom distribution. We provide education on safe injecting. So again, for those people that inject heroin or methamphetamine, we can provide them information on how to do that safer, preventing infection and hospitalization. We also offer harm reduction kits for IV users of illicit substances, and personal hygiene items. Every year, we're provided approximately 2,500 pairs of Bombas socks. We provide shampoos, soaps, dental hygiene items, and then other items as donated: tents, sleeping bags, gloves and hats in the winter, hand warmers, things like that. So to talk a little bit about some of the people we partner with in the community, we are part of CBJ's Street Outreach and are present at all their events here in downtown. We work with Plinkett Haida, their prevention programs, St. Vincent de Paul or Teal Street, and we provide case management services, vaccines, and hope to expand with the mobile medicine. Vaccine clinics for the Zach Gordon Youth Center, the Glory Hall, the warming shelter. We also partner with Alaska AIDS Assistance Association, or 4As. Approximately a year ago, for about 6 months, we helped with their syringe exchange while they were unable to do it because they didn't have the precautions in place due to COVID-19. And then soon we will be partnering with United Human Services at the Teal Street complex and be providing medical and behavioral health services from our mobile unit, starting at 2 or 3 days a week, and hoping to expand those services as the need arises. Just briefly wanted to touch on strategies we took to ensure that people receive services during the COVID-19 pandemic. We've expanded our services in a large way thanks to COVID-19. We're able to do telephone and virtual visits with people. We can provide a cellular Wi-Fi enabled tablet so they can, if people don't have access to technology, they can still see a provider and we can deliver the tablet to them. For safety precautions, we screen everybody that comes into the medical clinic, take their temperature, screen for signs and symptoms, provide ear loop masks, and provide rapid testing as needed. For dental services, all of their patients receive rapid testing prior to services due to aerosolizing procedures. So we want to keep our staff and our patients safe. We've decreased the number of patients allowed in the clinic to ensure social distancing, and all of Front Street and Search employees are vaccinated for COVID-19. We also provide employee testing weekly or as needed. For a time, it was required to receive testing, but as more and more people in the community are vaccinated, we've been able to decrease that. Finally, how do you get our services? So all of our services are same-day access unless it's a follow-up visit. So anybody can call here at 8:30 a.m. And in most cases, we can see people same day. They could also walk in, and likely we can get people seen immediately. Our regular office hours are 8:30 a.m. to 4:30 p.m. Monday through Friday. And to schedule mobile services, all somebody needs to do is reach out to me and we'll make those arrangements. That's it. Any questions?
You have to go up to the.
Well, they can't hear you if you're not up here, so you can, that would be helpful. Thank you.
I have a question.
Yes.
So do you do the clinic at the new homeless shelter place in Lemon Creek?
You mean where the Glory Hall is moving to?
No, Lemon Creek, where they,
Oh, no, we've not
Housing
done.
First, the one that Housing First built.
So we have done clinics, vaccine clinics there, but they also have on-site medical services there that has taken on all of their vaccines and medical services.
Okay, but that's not a First Street clinic
No,
Okay,
that's
okay.
associated with Jamie. Yeah.
with Jam. Okay, thanks.
Mhm.
So I have a question. With the kind of national, trying to make this not a political question because it's really not, but with kind of the national mood on reorganizing police, especially when responding to mental health issues that often can be violent. Do your folks roll out with the police department on mental health calls here? Thank you.
So could you elaborate a little bit more on that? What do you mean roll out?
Do you go, if, let's say somebody is having a breakdown, right? And it can be drugs involved, violence, and it's certainly mental health issues. And I don't know if we do that here, but down south, there seems to be the mood to have mental health professionals roll out or go out on those call outs, so that, because police respond in the way police respond, but if it's a
Right.
mental health issue, it might require a different response.
Yes. So unfortunately, we don't have the ability to do that. I know it's been talked about in the community on numerous occasions, how we need a crisis response team with qualified mental health professionals to go out with law enforcement. Unfortunately, to my knowledge, there is not that service available at this time.
Thank you.
So I had a question, Claudette. How many people do you guys serve?
So annually, somewhere around 400 to 500 unique persons at the clinic. So not including follow-up visits.
How many staff members do you have and what type of staff?
Currently, we have 10 full-time staff here at the clinic, and we have an additional 3 to 4 dental staff when they're here providing services.
Anyone else?
And are they nurses, nurse practitioners, PAs?
So we have 1.5 nurse practitioners on site. One's full-time, one works between Front Street and FL1 Medical Center. We have an RN. We have behavioral health case managers, 3 and 2 behavioral health therapists, as well as additional support staff.
Thank you.
Mhm.
Claudette, this is Linda, and just wondering, the numbers that you serve, has that increased or remained stable over the past few years?
Our services have increased exponentially. As when I first came in to Front Street approximately 4 years ago, we were staffed with 4 to 5 people, and so about 300 unique individuals annually. Again, in just a few short years, that's almost doubled. And that doesn't include those people that we provide harm reduction, supplies, hygiene items to. Those aren't even counted. So it's just, or crisis visits. So it's just those individuals that establish care, whether it be dental, medical, or behavioral health.
And what do you, what social issues are creating that increase, do you think?
I think COVID-19 has put a huge burden on a lot of people. Prior to that, there's been a huge increase in substance use, heroin, methamphetamine, homelessness. Affordable housing for people in the community is a huge barrier. You know, I don't have all the answers, but again, I think it's a combination of things: substance use, cost of living, housing. I don't know if that answered your question.
Yes, thank you.
Hi, I have a question.
Sure.
So hi, Claudette, thank you. This is Jill Matheson. I'm one of the optometrists in town that we work back and forth with on occasion. And I guess my comment is thank you. You know, when I do get those referrals from you guys, you guys do some really comprehensive things for people. So thank you for that. That's been really lovely. To see how much care you give that population. So my question is, you know, we have just many people, a lot of new people to town actually that are seeking care and sometimes need a medical referral. And it's, you know, a long time of a wait to get into, you know, one of the standard offices in town. Would you be someone that we could refer somebody to independent of their income or mental health status, I guess is the question?
Absolutely. We will see anybody. We've seen a little bit of a population change. So, as we are designated as healthcare for the homeless, however, over the past several years, we've really expanded those services to anybody needing services. Yeah, just reach out and
Thank you.
we'll make sure people get seen.
All right. Thanks for all you do. It's great.
Thank you.
Mhm.
Other questions?
This is Amy. I'm just wondering what kind of support would be helpful from, you know, caring community members who recognize the importance of what you do, and, you know, if there's any kind of resources you would need from volunteers of either time or, you know, items that might be helpful for what you do.
So, yeah, when we look at services, we have this great network of support services available in Juneau. Where we really struggle are things like hygiene items. I have a very small budget to provide those to people experiencing homelessness or that are underserved. So hygiene items during the winter, one of the things that's so difficult for people are having, dry socks, hats, gloves, boots. I've always wanted to do like a big boot drive for those experiencing homelessness. We got a huge number of trench foot cases during the winter because it's so wet here, and it can be really painful, and all it takes is dry socks and a pair of boots, and we can prevent that. So
Candy has a question.
any other questions?
I do have a question. Quite often we have gathered up toiletry items for the homeless youth or couch surfing youth and distributed that through the high school, which made me curious as to the kind of age groups that you guys are serving there at the Front Street.
So for medical services, our primary age group is 18 and above, although we do have the ability to see younger people. For behavioral health services, We can see anybody 3 years old and above. We have quite a few little ones that come into the clinic. Dental services are primarily adult, and children are referred to Search's main dental clinic. But again, I mean, we're not going to decline services to anybody if they need them. If we can't provide them, we're going to get them where they need to be.
All right, thank you, Claudette.
Thank
That
you,
was
Julie.
really interesting. It's nice to see you here. I think with that, do you want to go ahead and end the recording, Amy?